Question 1. An RBT is implementing a DRL, differential reinforcement of lower rates, procedure for a student who asks excessive questions. The criteria is to reinforce asking 3 or fewer questions per hour. If the student asks 4 questions in the first 15 minutes, what should the RBT do regarding reinforcement for the rest of that hour? A. Provide reinforcement immediately as the rate is already high. B. Wait until the end of the hour. If the total is 4, withhold reinforcement. C. Provide reinforcement at the end of the hour only if the student asks 0 questions in the remaining 45 minutes. D. Reset the interval and start counting again for the next hour. Answer B. Wait until the end of the hour. If the total is 4, withhold reinforcement. This question tests your understanding of how DRL procedures work, specifically full session DRL. The key is the criteria 3 or fewer questions per hour. DRL reinforces the behavior occurring at or below a certain rate within a defined time period, here 1 hour, even if the student exceeds the limit early on, 4 questions in 15 minutes. The RBT must wait until the entire interval, the full hour, is over to determine if the criteria was met for that whole session. Since 4 questions already exceeds the limit of 3, reinforcement would be withheld at the end of that hour. It's not about immediate reinforcement, A. Asking 0 in the remainder, C. Or resetting mid-interval, D. Remember, for full session DRL, you evaluate the total count at the interval's end. Question 2. During a functional analysis conducted by the BCBA, specific conditions are set up to test potential reasons for a client's hitting behavior. In one condition, the client is given difficult work and ignored. If hitting occurs, the work is removed for 30 seconds. What function is this specific condition designed to test? A. Access to tangibles. B. Attention. C. Automatic reinforcement. D. Escape/avoidance. Answer D. Escape/avoidance. This question requires you to link specific functional analysis conditions to the behavioral function being tested. The key elements are difficult work, an antecedent suggesting an aversive situation, and work is removed, the consequence provided only if hitting occurs. This setup directly tests if the hitting behavior is maintained by escaping or avoiding the difficult task. If hitting increases significantly in this condition compared to a control condition, it suggests the behavior serves an escape function. It's not testing for getting items. A. Getting attention. B. Or self-stimulation. C. Think. What does the behavior result in this specific setup? Here, it results in escape from work. Question 3. An RBT is teaching a client to request for juice. The BCBA instructs the RBT to ensure the client hasn't had anything to drink for an hour before the session to increase the effectiveness of juice as a reinforcer. Manipulating the client's access to drinks like this is an example of altering. A. Discriminative stimuli. STI. B. Response effort. C. Motivating operations. MOs. D. Contingencies of reinforcement. Answer C. Motivating operations, MOs. This question tests the difference between MOs and other behavioral concepts. The key action is restricting access to drinks before the session to make juice more valuable. A motivating operation, MO, is an environmental variable that alters the reinforcing effectiveness of something, like juice, and alters the current frequency of behavior related to it, like asking for juice. Depriving the client of drinks increases the value of juice, an establishing operation. This is different from an SD, a signal that reinforcement is available, response effort, how hard the behavior is, or the contingency itself, the if-then rule. Remember, MOs change how much someone wants something and how likely they are to try and get it right now. Question 4. Behavioral contrast occurs when a change in reinforcement/punishment in one setting leads to an opposite change in behavior in another setting where the contingency is unchanged. If an RBT implements a punishment procedure for yelling at school and yelling increases at home, where no new punishment is used, this exemplifies A. Positive behavioral contrast. B. Negative behavioral contrast. C. Response generalization. D. Stimulus discrimination. Answer: A. Positive behavioral contrast. This question defines behavioral contrast and asks you to identify the specific type based on the scenario. Behavioral contrast describes how behavior changes in one situation when the consequences change in another situation. The key here is that punishment at school leads to an increase in the behavior at home. Positive behavioral contrast is when a decrease in behavior due to punishment or extinction in one setting results in an increase in that same behavior in other settings. Negative contrast is the opposite. Increase in one setting leads to decrease elsewhere. It's not generalization, skill spreading, or discrimination, responding differently to different stimuli. Think contrast equals opposite effect in the other setting. Question 5. An RBT is trying to fade prompts during a shoe tying task analysis. They start with full physical guidance, then move to light physical guidance, then shadowing the hands, then just a gesture. This systematic reduction of intrusive prompts describes what specific fading procedure? A. Stimulus fading. B. Least to most prompt fading. C. Most to least prompt fading. D. Time delay prompt fading. Answer: C. Most to least prompt fading. This question asks you to identify a specific prompt fading strategy. The key is the sequence of prompts, starting with the most intrusive, full physical, and systematically moving towards less intrusive prompts, light physical, shadowing, gesture. This approach is called most to least prompt fading. It ensures initial success by providing maximum help, then gradually withdraws that help. Least to most starts with minimal help and increases if needed. Stimulus fading changes the target stimulus itself. Time delay inserts time between the instruction and the prompt. Remember, most to least starts heavy and gets lighter. Question 6. A client's behavior plan requires the RBT to implement a fixed interval, phi, schedule of reinforcement. If the schedule is in 5 minutes for staying seated, when is reinforcement delivered? A. Every 5 minutes exactly, regardless of behavior. B. The first time the client sits down after any 5-minute period has passed. C. For the first instance of staying seated that occurs after 5 minutes has elapsed. D. Continuously as long as the client remains seated for at least 5 minutes total. Answer: C. For the first instance of staying seated that occurs after 5 minutes has elapsed. This question tests your understanding of fixed interval schedules. The fixed interval part means reinforcement becomes available after a set amount of time, 5 minutes. The critical point is that reinforcement is delivered for the first correct response that occurs after that interval has ended. It's not delivered automatically just because time passed, A, nor for just sitting down initially, B, nor continuously, D. The client must perform the target behavior, staying seaweed, after the 5-minute timer is up to earn the reinforcer. Think FI equals first response after the fixed time is up gets the reward. Question 7. An RBT is working in a school and a client's teacher, who is not part of the ABA team, asks the RBT for a copy of the full behavior intervention plan, BAP, to better understand the student. What ethical consideration is most critical for the RBT to address first? A. Ensuring the teacher understands the technical ABA terms in the BAP. B. Determining if sharing the full BIP complies with confidentiality policies and obtaining necessary consents. C. Explaining to the teacher that RBTs cannot create or modify BIPs. D. Asking the supervisor if the teacher seems capable of implementing the BIP correctly. Answer: B. Determining if sharing the full BIP complies with confidentiality policies and obtaining necessary consents. This question involves ethical guidelines regarding information sharing and confidentiality. While other options might be relevant eventually, the most critical first step when asked to share client documentation, like a BIP, with someone outside the immediate treatment team, is ensuring compliance with privacy laws like HIPAA and agency policies. The RBT must verify if consent for sharing information with the teacher exists before sharing the document. Sharing protected health information inappropriately is a serious breach. Teacher understanding. A. RBT scope. C. And teacher capability. D. Are secondary to the fundamental issue of authorized information release. Always check permissions before sharing client info. Question 8. Stimulus equivalence occurs when, after learning certain stimulus-stimulus relations, example, A equals B, B equals C. An individual demonstrates untrained relations, example, A equals C, C equals A. If an RBT teaches a child that the spoken word cat, A, matches a picture of a cat, B, and then teaches that the picture, B, matches the written word cat, C, and the child then reads the written word cat, C, when hearing the spoken word cat, A, without direct teaching, this demonstrates which emergent relation? A. Reflexivity. A equals A. B. Symmetry. If A equals B, then B equals A. C. Transitivity. If A equals B and B equals C, then A equals C. D. Baseline performance. Answer: C. Transitivity. If A equals B and B equals C, then A equals C. This question delves into derived stimulus relations, a complex topic. The core concept is stimulus equivalence, where stimuli become related without direct training on every combination. Here, a spoken word was trained to B, picture, and B, picture, was trained to C, written word, the emergence of the A equals C relation. Hearing spoken cat leads to reading written cat, demonstrates transitivity, the transfer of relation through a common element, B. Reflexivity is identity matching. Cat picture equals cat picture. Symmetry is the reversal of a trained relation. If taught A equals B, B equals A emerges. Since A equals C emerged via the linked training of A equals B and B equals C, it's transitivity. Think transitive equals transfer across a middleman stimulus. Question 9. An RBT is measuring the percentage of opportunities a client responds correctly to a specific instruction during DTT. Over 5 trials, the client responds correctly on trials 1, 3, and 5. What is the calculated percentage of correct responses? A. 50%. B. 60%. C. 75%. D. 100%. Answer: B. 60%. This question requires a basic calculation often used in ABA data analysis, percentage. The key is to find the proportion of correct responses out of the total opportunities. The client had 5 opportunities, trials, and responded correctly 3 times, trials 1, 3, 5. To calculate the percentage, divide the number of correct responses by the total number of opportunities and multiply by 100, correct responses / total opportunities. Asterisk 100 equals 3/5. Asterisk 100 equals 0. 6 asterisk 100 equals 60%. Even under pressure, remember the simple formula. Part/whole, asterisk 100. Question 10. A client's behavior plan includes a strategy to teach them to wait patiently. The RBT is instructed to use a progressive time delay procedure. How would the RBT implement this? A. Start with a long delay and gradually decrease it as the client waits successfully. B. Start with a 0-second delay, prompt immediately, and gradually increase the time between the cue and the prompt. C. Use the same fixed delay duration consistently throughout the teaching process. D. Only provide a prompt if the client makes an error after waiting for a predetermined time. Answer B. Start with a 0-second delay prompt immediately and gradually increase the time between the cue and the prompt. This question asks about a specific prompt fading technique, progressive time delay. The defining feature of time delay is inserting time between the natural cue or instruction and the prompt. In a progressive time delay, you start with a very brief, often 0-second delay, ensuring the client gets the prompt right away. Then you systematically increase the delay duration example to 2 seconds, then 4 seconds, across trials or sessions, giving the client more opportunity to respond independently before the prompt occurs. This transfers control from the prompt to the natural cue. Think time delay equals inserting wait time before the prompt. Progressive equals gradually increasing that wait time. Question 11. An RBT observes that their client consistently complies with instructions from the BCBA, but often refuses to follow the same instructions when given by the RBT. This difference in responding based on who gives the instruction suggests an issue with A. Stimulus generalization across people. B. Response maintenance. C. Functional equivalence of instructions. D. Stimulus discrimination between people. Answer D. Stimulus discrimination between people. This question tests your understanding of stimulus control, specifically discrimination versus generalization. The key is that the client responds differently, complies vs. refuses, to the same instruction depending on who gives it, BCBA vs. RBT. This indicates the client is discriminating between the two people. The BCBA likely signals reinforcement for compliance, while the RBT currently does not or signal something else. Stimulus discrimination is when a behavior occurs more often in the presence of one stimulus, SD, than in the presence of another, S delta. It's the opposite of stimulus generalization, A, where the behavior would occur similarly with both people, maintenance. B is about behavior persisting over time. Question 12. When defining a target behavior for measurement, operational definitions are crucial. Which of the following is the best operational definition for aggression? A. Any instance where the client seems angry or upset. B. Hitting, kicking, or biting towards another person. C. Any attempt to physically harm self, others, or property. D. Any instance of forceful physical contact initiated by the client towards another person's body or clothing, example, striking with open hand or fist, kicking with foot, biting leaving a mark or indentation. Answer D. Any instance of forceful physical contact initiated by the client towards another person's body or clothing, example, striking with open hand or fist, kicking with foot, biting leaving a mark or indentation. This question focuses on the characteristics of a good operational definition: objective, clear, and complete. An operational definition must describe the behavior in observable and measurable terms, leaving no room for interpretation. Options A and C use subjective terms, seems angry, attempt, or are too broad. Option B is better but less specific than D. Option D is the best because it clearly describes the topography, form, of the behavior, forceful contact, specific actions like hitting, kicking, biting, and includes examples, making it unambiguous and measurable by different observers. Good definitions pass the stranger test. Someone unfamiliar could read it and reliably identify the behavior. Question 13. An RBT is working with a client who receives reinforcement on a variable ratio, VR, schedule for completing tasks. What pattern of responding is typically associated with a VR schedule? A scallop pattern with a pause after reinforcement, followed by accelerating responding. B. A steady, high rate of responding with little or no pausing after reinforcement. C. A moderate, steady rate of responding with consistent pausing. D. A very low rate of responding that increases just before reinforcement is available. Answer B. A steady, high rate of responding with little or no pausing after reinforcement. This question tests your knowledge of the characteristic effects of basic schedules of reinforcement. Variable ratio, VR. Schedules deliver reinforcement after an unpredictable number of responses, averaging around a specific number. This unpredictability and the link between responding and reinforcement tend to produce very high, steady rates of behavior with minimal pausing after reinforcement. Think of slot machines. People keep playing rapidly because the next pull might be the winner. Fixed interval schedules produce scallops. A. Fixed ratio can have post-reinforcement pauses. C. And variable interval produces steady moderate rates. It is not typical of VI. VR equals very rapid responding. Question 14. According to the RBT Ethics Code 2.0, RBTs have a responsibility to maintain competence. If an RBT is assigned a case requiring skills outside their current training and experience, example, implementing a complex feeding protocol, what is the most ethically appropriate course of action? A. Accept the case and try to learn the necessary skills independently through online research. B. Accept the case but inform the supervisor they will only implement the parts they feel comfortable with. C. Decline the specific tasks or the case until adequate training and supervision are provided. D. Ask a more experienced RBT colleague to handle those specific tasks for them. Answer C. Decline the specific tasks or the case until adequate training and supervision are provided. This question addresses the ethical obligation of competence, Section 1.02 of the RBT Ethics Code 2.0. RBTs must only practice within the boundaries of their competence based on their education, training, and supervised experience. If assigned tasks beyond their current skill set, the ethical requirement is to obtain the necessary training and supervision before providing those services. Trying to learn independently, A. Partially implementing, B. Or delegating to a peer without supervisor direction, D. Does not meet this standard. The RBT must communicate the need for training/supervision to their supervisor and refrain from practicing outside their competence. Your supervisor needs to ensure you're trained before you do something new or complex. Question 15. What is the key difference between a multiple stimulus without replacement, MSWO, preference assessment, and a multiple stimulus with replacement, MS, preference assessment? A. MSWO presents more items in the initial array than MS. B. MSWO requires the client to rank the items verbally. C. In MSWO, the chosen item is removed from the array for subsequent trials. In MS, it is put back in. D. In MS, the position of items in the array remains constant. In MSWO, positions are randomized. Answer C. In MSWO, the chosen item is removed from the array for subsequent trials. In MS, it is put back in. This question requires distinguishing between two specific types of multiple stimulus preference assessments. The defining difference lies in what happens to the item after the client chooses it. In multiple stimulus without replacement, MSWO, the selected item is taken out, not replicity, for the next trial within that assessment session. In multiple stimulus with replacement, MS, the selected item is returned to the array, potentially allowing it to be chosen multiple times. This procedural difference impacts how preference hierarchies are determined. Think WO equals without replacement, item taken out. Question 16. An RBT is graphing frequency data for a behavior targeted for reduction. The graph shows a steep decreasing trend during the intervention phase, but there are several data points significantly higher than the surrounding points. What aspect of the data do these higher points represent? A. Variability. B. Level. C. Trend. D. Stability. Answer A. Variability. This question asks you to interpret a feature of graphed data using visual analysis terms. Variability refers to the extent to which data points fluctuate or bounce around the general trend or level. Points significantly higher or lower than the overall pattern indicate high variability. Level refers to the average value within a phase. Trend refers to the overall direction of the data path. Increasing, decreasing, zero. Stability implies low variability. Those spike points that deviate from the pattern show the variability or bounce in the data. Question 17. A BCBA designed an intervention using non-contingent reinforcement, NCR, to address attention-maintained disruptive behavior. How should the RBT implement NCR? A. Provide high levels of attention only when the client engages in appropriate behavior. B. Provide attention on a fixed or variable time schedule, regardless of the client's behavior at that moment. C. Provide attention only immediately following instances of disruptive behavior. D. Provide attention contingent on the absence of disruptive behavior for a specified interval. Answer: B. Provide attention on a fixed or variable time schedule, regardless of the client's behavior at that moment. This question tests your understanding of non-contingent reinforcement, NCR. NCR involves delivering the identified reinforcer, in this case, attention, on a time-based schedule, fixed or variable, completely independent of the client's behavior. The goal is to break the link between the problem behavior and the reinforcer by providing the reinforcer freely, thus reducing the motivation for the client to engage in the problem behavior to get it. It's not contingent on good behavior, A, which is DR, bad behavior, C, which would increase it, or the absence of behavior, D, which is DRO. NCR equals reinforcement is not contingent on behavior, just time. Question 18. Which of the following scenarios best illustrates response generalization? A. A client learns to say thank you to their RBT and then starts saying thank you to their parents and teacher. B. A client learns to identify a picture of a dog and can then identify different breeds of dogs. C. A client learns to ask for juice and later starts asking for drink or thirsty to get juice. D. A client learns to only ask for toys during playtime and not during work time. Answer: C. A client learns to ask for juice and later starts asking for drink or thirsty to get juice. This question asks you to identify response generalization, which can be tricky to distinguish from stimulus generalization. Response generalization occurs when a learner emits untrained behaviors that are functionally equivalent to the trained behavior. Here, the client was trained to say juice, one response, but starts using other related responses, drink, thirsty, to achieve the same outcome, getting juice. Stimulus generalization, B, involves the same response occurring in different situations or with different stimuli. Discrimination, D, involves responding differently in different situations. Response generalization equals different responses, same effect/outcome. Question 19. An RBT is told to use extinction for a behavior maintained by automatic reinforcement. Example, sensory feedback from finger flicking. How might extinction be applied in this specific case? A. Ignoring the finger flicking when it occurs. B. Providing praise when the client is not finger flicking. D. RARO. C. Preventing or blocking the finger flicking movement. Response blocking. D. Providing a preferred tangible item whenever finger flicking occurs. Answer: C. Preventing or blocking the finger flicking movement. Response blocking. This question challenges the common understanding of extinction, ignoring, by applying it to automatically reinforced behavior. Extinction means removing the specific reinforcement maintaining the behavior. If the reinforcement is the sensory feedback from the behavior itself, then ignoring it, A, won't remove the reinforcement. In this case, extinction often involves altering the consequence produced by the behavior, such as masking the sensory input, or more commonly for RBTs under supervision, using response blocking to prevent the behavior, and thus the sensory feedback, from occurring, DRO, B is a differential reinforcement procedure, not extinction. Providing tangibles, D would be reinforcement. For automatic reinforcement, extinction often means removing the sensory consequence, sometimes via blocking. Question 20. A client's BAP specifies using a token system with backup reinforcers. The RBT notices the client earns many tokens but rarely exchanges them for backup reinforcers, and their motivation seems low. What is the most likely issue? A. The token production schedule, how tokens are earned, is too thin. B. The cost response, losing tokens, is too high. C. The backup reinforcers are not currently motivating or are too difficult to earn, exchange rate too high. D. The tokens themselves are not preferred stimuli. Answer: C. The backup reinforcers are not currently motivating or are too difficult to earn, exchange rate too high. This question requires analyzing a potential problem within a token economy. The key clues are that the client earns tokens but doesn't spend them and motivation is low. This strongly suggests the backup reinforcers, the items/activities the tokens are traded for, are the problem. They might not be things the client actually wants right now. Low motivation/value, or the price, exchange rate, might be set too high, making it too hard to get them. If earning tokens was too hard, A. They wouldn't have many. Cost response. B isn't mentioned as an issue. While tokens should be conditioned reinforcers, the lack of exchange points primarily to the backup reinforcers. C. If the backups aren't worth it, the tokens lose their value. Question 21. When teaching skills using discrete trial training, DTT, the intertrial interval, ITI, is the time between the end of one trial and the beginning of the next. What is the primary function of the ITI? A. To allow the client time to consume the reinforcer. B. To provide a brief pause, help delineate trials, and allow the RBT to record data. C. To punish incorrect responses by delaying the next trial. D. To present the next instruction. C. Immediately to maintain momentum. Answer: B. To provide a brief pause, help delineate trials, and allow the RBT to record data. This question asks about the purpose of a specific component of the DTT cycle, the intertrial interval, ITI. The ITI serves several functions. It creates a clear end to one consequence and start to the next instruction, preventing confusion. It gives the RBT a moment to record data from the just completed trial, and it provides a brief pause, which can vary depending on the client and goals. While consuming a reinforcer might happen during the ITI. A. That's not its primary function. It's not intended as punishment. C. While momentum is good, a brief, clear ITI is standard DTT practice, not immediate SD presentation. D. Unless specifically programmed. Think ITI equals pause between trials for reset and recording. Question 22. An RBT is working with a client who has mastered identifying colors receptively, pointing to the named color. The BCBA now wants to teach expressive identification, naming the color when asked, "What color is this?" This shift from listener responding to speaker responding, tacting, involves teaching across different A. Stimulus classes. B. Response topographies. C. Verbal operants. D. Reinforcement schedules. Answer: C. Verbal operants. This question tests your understanding of B. F. Skinner's analysis of verbal behavior, specifically different verbal operants. Receptive identification, point to blue, is listener behavior. Expressive labeling, what color? Greater than blue, is attacked. A verbal response controlled by a nonverbal stimulus, the blue object, and maintained by generalized conditioned reinforcement. Praise, teaching the client to shift from pointing, listener, to naming, speaker/tact, involves teaching a different functional unit of language, a different verbal operant, while the response topography changes, pointing vs. speaking, B. The core difference lies in the functional classification of the verbal behavior. C. Question 23. A client engages in severe self-injurious behavior. Side B. The behavior plan requires immediate implementation of a protective procedure, example, blocking use of protective equipment, whenever Side B precursors are observed. What is the RBT's ethical obligation regarding implementing such physically intrusive procedures? A. Implement only if the RBT personally agrees it's the best approach. B. Implement as specified, but only after receiving specific training and demonstrating competence. C. Refuse to implement any procedure involving physical contact due to liability concerns. D. Modify the procedure slightly based on the RBT's judgment in the moment. Answer: B. Implement as specified, but only after receiving specific training and demonstrating competence. This question deals with the ethical implementation of potentially restrictive or intrusive procedures, while RBTs must follow the BIP. Procedures involving physical management or protective equipment require specific, documented training and demonstrated competency under supervision before implementation. The RBT's personal agreement, A, isn't the deciding factor. Refusing all physical contact, C, may conflict with client safety needs if specified in the plan. Modifying procedures without supervisor approval, D, violates treatment integrity and ethical guidelines. The key is competence. You must be trained and deemed competent before using such procedures. Question 24. Which scenario describes a potential respondent conditioning, classical conditioning, effect occurring alongside operant conditioning during ABA sessions? A. A client learns to associate the RBT smile, neutral stimulus, with receiving praise, unconditioned/conditioned reinforcer, and eventually the RBT smile alone elicits a feeling of happiness, conditioned response. B. A client learns that pressing a button, operant behavior, results in music playing, reinforcement. C. A client learns to ask for a break, operant behavior, to escape a difficult task, negative reinforcement. D. A client's rate of completing math problems, operant behavior, increases when points are delivered on a VR schedule, reinforcement. Answer: A. A client learns to associate the RBT smile, neutral stimulus, with receiving praise, unconditioned/conditioned reinforcer, and eventually the RBT smile alone elicits a feeling of happiness, conditioned response. This question asks you to identify respondent, classical, conditioning, which involves reflexes and stimulus pairings, often occurring simultaneously with operant conditioning. Learning via consequences, respondent conditioning pairs a neutral stimulus, NS, with an unconditioned stimulus, US, or a strong conditioned stimulus, CS, until the NS becomes a CS, eliciting a conditioned response, CR. In option A, the smile, NS, is repeatedly paired with praise, US/CS eliciting good feelings, eventually causing the smile alone, now a CS, to elicit happiness, CR. Options B, C, and D describe operant conditioning, behavior shaped by its consequences. Respondent conditioning is about stimulus pairings triggering involuntary responses. Question 25. An RBT is using whole interval recording to measure a client's cooperative play during 2-minute intervals. In one interval, the client plays cooperatively for the first 90 seconds, then argues with a peer for the last 30 seconds. How should the RBT score this interval? A. Record an occurrence, plus, because cooperative play happened during the interval. B. Record a non-occurrence, because cooperative play did not happen for the entire interval. C. Record both an occurrence, plus, for cooperative play and a non-occurrence. For arguing, D. Record partial occurrence, plus / as the behavior occurred for part of the interval. Answer B. Record a non-occurrence, because cooperative play did not happen for the entire interval. This question tests your precise understanding of whole interval recording rules. Whole interval recording requires the target behavior to occur continuously throughout the entire duration of the observation interval to be scored as an occurrence. Plus, if the behavior stops at any point during the interval, even for a second, the entire interval is scored as a non-occurrence for that behavior. Since the cooperative play stopped before the 2-minute interval ended, it does not meet the criteria for whole interval recording. Partial interval would score this as plus. Remember, whole interval equals has to happen the whole time.